Looking back on it, it's kind of like, did that really happen? It's like, I was 26. The word stroke never made any sense.
She had a violent headache. We had all the blinds drawn. We had the room as dark as we could possibly get it during the middle of the day, but her headache was just ferocious. And then she says, and how do I spell my last name? And then I knew something horrible had happened.
We went to the hospital immediately after that.
Dr. Hill came in and ordered some tests, a CAT scan. We were immediately ushered up to ICU.
A lot of it is a little foggy, kind of the next couple weeks. And I do remember going through a lot of tests, and they identified that I had had a stroke. And I remember I was doing better. My mom was spending the night with me one night. I just remember feeling really bad, and that's really the last I remember.
They came and got me and said, we need to go to the surgical unit. And I'm just confused. I'm thinking, why? Her brain has started swelling. She had not only a blood clot, but she had bleeding on the brain.
We just prayed that that God would be with the surgeons, and they were. And when they brought her back after the surgery, they kept her in a drug-induced coma for a while.
They removed a portion of my skull to alleviate the swelling. In modern medicine, weird world, they stuck it in my stomach so it was there for 6 months.
It was tough, sleeping on the floor of ICU that night, not wanting to be far away from her. Those are the things just being there and praying for was, the best I could do.
He had good blood pressure. He was healthy. Wasn't diabetic or anything. No pre-existing conditions. Best shape of his life.
He helped me lose 85 pounds. He trained me for an Ironman triathlon. Just an all-around great person. Just amazing. We were in the gym and we had just finished working up in the front. He bent down to pick up 2 medicine balls, and he picked up a heavy one, like 12 pounds with his right hand, and with his left hand he picked up like maybe a 3-pound one, and his arm just went down. And he stood up and I said, "Are you okay?" He was face down and the whole right side was just bent, and it was just nonsense. Just the garbled speech.
He has a small tear in his carotid artery, and that's what caused the clot, and the clot broke free and caused a stroke. It's like a 1 in a million chance to happen.
I was at the gym and I was working out, and my head started hurting really bad. We got my friend's car, and he drove me to the urgent care on Town Lake. I got out of the car, threw up, and that's pretty much the last thing I remember. I had this thing called an AVM, arteriovenous malformation. It's just a bunch of malformed veins, and they just couldn't hold the pressure.
Nobody knows what's going to cause it to rupture. It didn't cause because he was weightlifting, because he had just started. He wasn't stressing or straining. It just did, and they occur often at about his age to 20-something. Your body's growing, your blood volume, and then it can rupture. And that's what happened to John. The pressure was too high, and it just ruptured. I don't know how Dr. Caldy stood over that table for 16 hours working on John's head. He told me after the surgery that it was a lot of work and we didn't know if John's speech would be affected. Expecting right side paralysis or weakness again, but we were thankful he was alive.
We would talk to him and hold his hand, and you never knew if, would he ever respond? Would he ever wake up?
We went back in the morning when Dr. Caldy got back in, and John pushes the sheet off with his right hand and reaches out and shakes hands with him.
David was actually very, very sick with his stroke, very critically ill for many, many days, and I just think it's a miracle that he has come as far as he has just because of how sick he was with his initial stroke.
I've seen a big change from really not being able to communicate even basic things about himself to having a conversation.
In every sense of the word, she is a miracle.
It was a team effort. My doctors who spent countless hours, my nurses, especially in the ICU and the step-down unit, they just became part of the family.
It was probably the most dramatic, frightening time of our lives. But I will tell people it was not a test of faith, it was a testimony of faith.
We have found out that faith really is important. It works through the nurses, the doctors, even as far as the people that, that bring you the food and clean the rooms. Without a doubt, Wellstar does a great job in this community.
They will always be a part of my life.